So we all know it's so difficult financially in general practice at the moment. And I would just say, make sure you have got a risk register for your practice. That's another top tip. And finances should be on there. So, for example, the minimum wage goes up in April, I think, to £12.71. What plans have you made for that? Because that's if you've got someone that was on minimum wage full time, that's just over £1,000 more a year that equates to. So, what plans have you made for that pay rise, and also how that impacts other roles? Because you know what it's like in general practice. One of the main things every member of staff we ever speak to says is about money, about wages. And if the minimum wage has crept up, that impacts on all the other roles as well. So be planning for that, because that's going to be here before we know it. And I think one of the really important things with finances now is every ICS has slightly different ways of dishing out money or what money they can have. So you really need to understand, just ask your ICB leads actually what funding is out there. Most funding now comes through a lot through PCNs. So actually, are you aware of what your PCNs do with that funds, what you're using it for? Are you using those funds in the right way? So I mentioned previously about Captain PCN, Nikki Potts. I remember last year we had some funds left for our R's, and we want to do something that really impacted on patients in a positive way, but also the teams financially. So we did weekend clinics with nurses for wound care, for health checks. So it's something that was really supporting our communities, because those patients we found were having trouble getting in the week, but it also helped support the practices financially, because obviously we get those payments as well. So things like that. And then real basics, look at your FP10s. What are you claiming for monthly? When you're buying supplies in, check the prices. Is it cheaper to do it as a PCN? Because we only get a set amount of money back for every item that we process. Are you buying it somewhere that's more expensive, so you're making a loss on all of those? Are you claiming for everything? And then the last thing I would say is definitely look at your enhanced services and local enhanced services, LCSs. They're all different things across the country, but be reviewing them monthly. Has your income dropped from those? Why? Are you using wrong codes? Are you not using the right templates? Is everyone aware of changes to those services? Because sometimes things you could claim for, something you can't, or you can claim for something else. But they need to be reviewed monthly as well, because if you leave it quarterly, you can't do anything about it. It's too far gone. So really have someone be looking at those, your nursing team maybe. Make sure we understand the changes that are coming out. The public health enhanced service specs have come out now as well. So be reading through, or get someone to read through those. Note any changes. Make sure you're claiming for what you deliver, because you're delivering this great stuff, but we're not always claiming for it. So just go back to basics and check those things. And obviously just be ready for what's announced. We probably won't get it until April the 1st if we're lucky, but what those new contract changes mean for us financially.
Just want to talk to all you practice managers out there, because we recognise the pressure that you're under, and all the practice managers that we've been around visiting, and the responsibility that you feel you hold on your shoulders to make sure that everything is good and everything is okay. And that pressure is massive. We just want to give you a little bit of a helping hand, free of charge, and just say about what we found out there. So with our CQC mock inspection hats on, it's around the governance within a practice is so essential. It is in any healthcare, any service provider, absolutely. It's making sure that your policies and procedures are up to date, and not just up to date, but you've got documented evidence that all your staff know where to find them. They know what the processes from those policies are. And if they were asked how to do something, they would either know it off pat or go, actually, I know where I could find that, and this is where I'd look it up, and easily be able to find it. A lot of practices we found, yes, they've got policies, and they sit there, but they've not been communicated to any of the staff of where they are, but more majorly from that is the policy. There is no process, no standard operating process that's been designed from that policy, because that's all slightly individual in a practice. For example, collecting specimens, what's the process for that? So it's the documentation around that. Most CQC inspections, if a practice is going to fall down, it will be on safe or well-led. So under your safe umbrella is your governance, all your policies, procedures, your infection prevention control. Is that up to date? Have you got a lead on that? How are they supported? Have they got protected time to carry out that role properly? Your safeguarding lead, does everybody know who they are? Make sure that you've got a safeguarding deputy in place and everybody knows who that is. Quite often people have got a safeguarding lead but no deputy. So what happens when that safeguarding lead goes on holiday? Make sure your safeguarding contact details are on the wall and visible in every clinical room, so that it's there in front of people. Make sure above your sinks there's how to wash your hands properly. All little things like that. All those little things are so important. It makes staff feel that they are involved in everything. You could look at all your policies and procedures and identify champions within your practice. If you've got an HCA, they may want to be the champion for the hand hiding, washing process and audit. Use all your staff, involve them. They love that. Don't you think, Marianne?
Yeah, I really do. And we've seen that time and time again. And I know from the practices I've managed, you can't do it alone. And you do, as a practice manager, carry it all on your shoulders, just like Lorraine said, but you can't do it alone. So actually utilise your team and find out what interests people have got as well and spread that out. And that's what our action plan can help with. Well, hopefully we've been of some help to you all and made you a little bit aware about the type of things we can support with and the services we offer. But it'd be great to hear from you. Even if it's not something we've discussed today, please do get in touch. Either you can email myself or Lorraine or Emily, and those details will be on the screen, or visit our website, nhgp.co.uk, and hopefully we'll be in touch with lots of you soon. Thanks so much for your time.